When you think about healthcare administration programs, you think about the fact that they really focus on people who want to become managers in current systems. So if you want to be a chief operating officer, a chief financial officer, really understand how these systems operate today, healthcare administration is a great degree to have. But we take a slightly different approach. We're really looking in healthcare delivery sciences at the future of healthcare delivery. What do we expect healthcare to look like in 5 years, 10 years from now? What are going to be the policies and reimbursement schemes that shape the delivery of healthcare? What are going to be some of the diseases that we're going to want to focus on? And probably most importantly, what about the populations we want to serve? So what are going to be the needs of people as they grow older, as they live longer but with more chronic illness? How do we handle issues like mental illness, which is very much a part of delivering standard care? And the other thing that we have to take into account now, more than we ever have, is what are the socioeconomic demographics of our populations? So for example, do people have access to transportation, safe housing, food security? Are they at risk for interpersonal violence? And again, mental health issues that arise within the community become very important for taking care of physical illness that we typically see. So our program hopefully is going to take a step beyond current offerings and really look at what are going to be the needs of communities in the future as we deliver healthcare for them. So healthcare delivery sciences really arose to answer that question, and it turns out that there is a real science around trying to figure out healthcare delivery. You can measure it and you can manage it. The problem is that those programs only exist right now in the US, basically on the East Coast and the West Coast. So through effort from several people here in the community, we have launched a healthcare delivery sciences program right here in Tulsa. We'd like to recruit people who have a clinical background and also those who don't necessarily practice medicine or have a clinical background, but are interested in working in the healthcare industry, insurance or pharmaceuticals or devices or health law.